Welcome to Inside Healthcare with CEO and President of MagnaCare, Joseph Berardo Jr. Today, he'll be discussing municipalities and self-insured health plans. Why are municipalities and other public entities turning to self-insured health plans?
You know, municipalities, school districts, and other public entities are beginning to move towards self-insurance, and in fact, many of them are beginning to explore a relationship with MagnaCare, really driven by what's going on outside in the climate, both in New York and New Jersey. Specifically, there's been legislation that's been passed in both states limiting tax increases. So in New York, property taxes can only go up by 2.5%. In New Jersey, they can only go up by 2%. In New Jersey, the 2% property tax cap has also been coupled by legislation requiring public employees to begin to contribute to their health plan, and in a phased-in approach, they will be contributing as much as 20% of the premium of the cost of their health plan, which is a huge difference than what's occurred in the past. So simply saying what's going on in the public sector marketplace is that they are all beginning to explore the different options available to them. So currently, and historically in the environments both in New York and New Jersey, typically a municipality might enroll in the state-sponsored health plan. The state-sponsored health plan might have a 10.5%, 12%, 14% rate increase. What would happen is each public entity would raise taxes to cover the increase in premiums and then begin to set their budgets beyond that. In the current environment, where they don't have the flexibility just to raise taxes to pay for premium increases, they're being forced to make choices around, do we pay for health insurance premiums, or do we fire municipal employees, reduce services, and change the way that we manage our particular entity? So it's really caused quite a stir in both marketplaces, where each municipality is beginning to explore all the options in the marketplace. Now, self-insurance for these individual entities really provides an opportunity for the municipality to have a budgetable maximum expense, so they know worst case scenario what they would spend by using stop-loss insurance, both specific and aggregate. However, if their health plan performs better, meaning that they have less claims than anticipated in the budget, they have the ability to recapture those dollars and bring them back into the municipal budget and use them for other sources or to create reserves for future years. So what's occurred really is a whole market shift that is causing a lot more consumerism to occur in the public sector market and requiring municipalities, school districts, boards of ed, and all others that are tax supported to start to think about how they truly are spending their dollars related to their health insurance programs.
How is MagnaCare educating municipalities about the benefits of self-insurance?
Well, MagnaCare has spent a lot of time educating municipalities, school districts, and different public entities about self-insurance by distributing and using a guide to self-insurance, which is on our website, and we've done that with targeted mailings. And then separately, what we've done is most of these municipalities and school districts are represented by brokers or consultants who specialize in the public markets. So there's really only a handful of entities that have multiple brokers that are used as consultants for these municipalities and school districts. So MagnaCare has done a number of sessions with these organizations, making sure that the brokers that have the relationships with these municipalities and school districts understand the benefits and the services offered by MagnaCare as it relates to their self-insured program. And in many cases, using examples and being given the opportunity to quote on the health plans and showing that a self-insured health plan can, in fact, out of the gate, save municipalities and school districts and other public entities money right at the beginning. And then over time, assuming that we manage the programs correctly by getting involved proactively in helping the members manage their chronic illnesses, get their preventive care, that over time we can bend the curve and the cost of the overall health insurance programs for those public sector entities.